July 2024 of CHC.
Am I audible? Kindly confirm.
Yes, you are audible, ma'am.
Sir, I am not able to hear you.
Alert, live caption visible.
Can any participants tell if I am able audible?
Audible, ma'am. Yes, ma'am.
Control E. Your microphone is on.
I'll do one thing. I'll just sign out and come back. Good evening. Am I audible?
Yes, ma'am.
Okay, thank you.
Control E. Your microphone is on. Control E. Your camera is off. Control E. Your camera is on.
Is the slide visible?
No, ma'am.
No?
No, ma'am.
How many participants are there?
I think only two, ma'am.
How many more to join? Any idea?
Another 4-5 members, ma'am.
We'll wait for another 5 minutes. It's okay.
Okay. Okay, ma'am.
Okay.
You have joined the call. There are 5 other people in the call. Your camera is on. Your microphone is on. Control D. Your microphone is on.
Ma'am, you are not audible.
Am I audible now?
Yes, you are audible.
Okay, let me start.
Yes, ma'am.
Is my slide visible?
Yes, ma'am.
Yeah. Okay. Just check if it is moving.
No, ma'am, it's not moving.
Not moving?
Yes, ma'am.
Now?
Now it's moving, but only that screen is coming.
That's what I cannot. This is a problem with the Google thing. Okay, I'll present like this only. Okay,
Okay.
let me just start with
Now
this.
it's moving, ma'am.
Yeah, fine. Good afternoon to everyone.
Good afternoon, ma'am.
Today's my topic is on administrative and practical aspects. I think we had all discussed that biomedical waste is an occupational safety issue, patient safety issue, environmental safety issue, and also important it's attitudinal issue. Now let's look at what are the points we need to consider when we are establishing healthcare waste management. There are four important components which we need to emphasize. One is the managerial and administrative aspects, integrated infection control management, disinfection and transportation, and capacity building, training and monitoring. Now, my topic is on managerial and administrative aspects. So, what is that we need to look at? We need to look at four important components. One is the systems approach to the healthcare investment, and what is the who are the personnel involved in the healthcare investment. And important is to have a continuous monitoring and evaluation and a waste audit which will help us to plan our things more clearly. And important is the waste management committee. Now, systems approach, what do I mean by systems approach to healthcare waste management? We must look at that healthcare waste management or the biomedical waste management. What we say is it is to be looked at in integrity as a part of the hospital systems. It should be an integral part of a healthcare delivery system. So we can't look at it in isolation because we know it is associated with occupational safety and patient safety. This has to be a part of our system as a whole. I mean to say a hospital system which is intended to deliver healthcare for its people. That is the way it has to go on. Next important is the coming to the integrated infection control. There are different components. We can talk of sources of hospital acquired infections, principles, precautions, and safety measures. I think I'll be touching only about the managerial and administrative aspects. And in disinfection and transport, we talk of principles of disinfection, transportation mechanism within and outside the healthcare facility, and proper waste storage facilities. And one more important thing is capacity building, training, and monitoring, which is very crucial for any of the thing. Now let's come to the administrative and the managerial aspect. The first component of this is the systems approach to healthcare investment. What do we understand by system? As I told, we as an hospital should look at as one unit. So it is a set of interconnected, interdependent. See, things are interconnected, interdependent things that form a complex unity. Hospital, though it looks very simple, it has many other components. It has human resource, infrastructure, and more than that, even the interactions of the individuals between the faculty, between the patients, all those things. Next is the handling, storage, transportation, treatment, and disposal of waste. Finally, what we are looking at is to minimize the risk of the waste to the health and environment. That is our primary goal, and that is what even the Environment Protection Act tells. Primary goal is to protect our health and environment. So, what are the things we need to look at when we want to set up a system in place in an hospital? It could be an hospital, it could be an clinic, it could be a nursing home, or any other place. What is that it needs to be? What are the things we must keep in consideration? First, one of the if we are starting new or afresh, or even just to see that whether we are doing it right, look at conducting of a waste audit. I'll come to it little later. Then try to have systems or policies in place where we minimize our waste, and wherever possible we recycle the waste so that the quantum of the waste comes down significantly. And next is to look at for the identification of point of generation of waste. Why is this important? Anybody can tell? Why do you need to identify all the points of generation? Anybody can answer this? Why do we need to know about the point of generation of waste?
To segregate the waste at the point of generation.
Yeah, that is a primary thing which we must keep in mind. As I told the other day, the segregation at point of source or the point of generation is very critical for our effective waste management. Okay, so we need to know where are the point of generation so that we start our segregation there. If I'm starting the segregation there, I need to keep the bins there, right? I need to train the people that you have to put the waste into that bins then and there itself. Okay, that is the importance of identifying the point of generation. Next, have the compiling the inventory of waste. What are the types of waste generated? Because this will help us to know what containers should be kept and which how big the container should be. Okay, that will be one of the job of waste auditor to know. Like for example, in OT, we need a bigger yellow color waste because the quantum of infectious waste will be huge, right? Whereas in a OPD, your general waste is more and very small quantity of yellow waste. You need not have even the red and the sharp waste also if you're not giving injections. So it will help us to plan your waste management systems. Then disinfection at point of generation. At the point of generation, I mean to say that if possible, if you are disinfecting at the point is the best thing to happen. Now the rule says that all the lab waste, microbiological waste should be disinfected at the hospital level before you hand it over to the that is a common biomedical waste facility. And plan your waste transportation both on site and off site. How we are going to plan, who is going to do, when they are doing, how they are doing. All these things are important to keep in line with the legislation. Next, final disposal. Again, final disposal depends on whether you have a city of within the 75-kilometer radius or not. If it is within our 75-kilometer radius, it's easy for us to hand it over to the common biomedical facility. And but you have the responsibility to see that the waste which is generated from your hospital is properly disposed by the CBW. So this calls for our responsibility to also make a visit to the CBWTF and see that whether they are doing the waste disposal properly on behalf of us. See, basically they are nothing but the agency which is doing the work for us. They are doing on behalf of us. Are they looking at doing it properly is what we need to look at. Next, when we are developing the systems in place, we need to keep in mind our occupational safety. So, for occupational safety, what are the things we need to keep? One, the materials, okay, which is important for the individual safety. Could be your all your PPEs, hand hygiene consumables, etc. And but also important for that is your training and monitoring. All those things also play important role for occupational safety. Next, having system in place without monitoring is going to be absolute failure. We need to monitor the system very regularly, otherwise it's going to collapse because it's a day-to-day affair. Until unless it's built, there's an inbuilt culture. However culture it is, however habit it is, it has to be monitored. See, that is the human nature, right? If somebody doesn't monitor, we tend to relax. We tend to just don't care and be very casual about our approach. So that is very important. Next is training of staff. Please tell if I'm very fast, I can slow down a bit. Is this speed okay?
Yes, ma'am.
Okay, thank you. So now what are the how do we go about doing developing a system? First is you need to identify the people and assign job responsible for waste management. Okay, who is going to do what? Starting from segregation to final disposal. This means to say even doctors have the responsibility. It is their responsibility to do proper segregation. Again, nurses have the responsibility is to see there is segregation happening. She can be a check for even the doctors and trainees also. Okay. And next, the healthcare workers, that is your group D workers, or what do we say, waste handlers, who will be collecting and actually collecting and transporting. What is their responsibility? Okay. So you need to assign proper responsibilities how for specific roles for them in relation to waste management, and allocate sufficient human and financial resources. I think you all are aware that because we are handing over our waste to this common biomedical waste facility, we are obliged to pay the amount to manage the waste. So that means it incurs cost. Again, not only just for common biomedical waste facility, you need for consumables like your liners, buckets. If it gets damaged, you must have to replace. Then disinfectants or your technologies like microwave or autoclave, what you have kept for pre-treatment. All these things are important for maintenance of those things, and recurrent expenses. We need to have separate fund allocated. I think most of the hospitals are now realize that initially what would happen, people would say, why should we spend our waste money for this waste? Okay, why should we pay to the CTF? They are generating money from the recycling. But no, it has to be us who has to do the responsibility. Instead of us, they are doing. That's it. Next is waste minimization. How do we bring about this? This could be your purchasing policies and effective stock management, so that you uh, do not end up in wastage of waste. I mean, like expired drugs and all, you can avoid. And also segregation of waste at point of generation. As I told, this is the art of our waste management. This will ensure almost 50% or even more than that in effectively handling our waste. If you do not segregate waste here, you are going to mix the waste, and the quantum of waste is going to be huge. So that huge waste will cost us more in terms of disposal, in terms of handling it. Not only the cost, even the risk is going to increase. So, and we need to have implementation of safe handling, storage, transportation, treatment and disposal options. And as I was telling again, monitoring the system is also very crucial. Now, who are the categories of personnel involved in hospital waste management? Basically, it is the hospital managers and administrative staff who are very critical. One is to allocate sufficient fund and resources for the management of waste. Next, doctors, because they are generators of doctors and nurses who are generator of waste, and if they take up the responsibility, the system will be very clean, and they are looked as role models, and people will follow them. Next, we have the cleaners, class 4 employees, and waste handlers who are who are the ones who are at higher risk, but they are less informed, correct? Because they may not be aware of the consequences of poorly mishandling the waste, okay? So, they are at higher risk of injuries or infections. So, these are some of the critical people who are involved in the healthcare waste management. Now, the other important component which we are talking was evaluation of the system. What do you mean by evaluation? Evaluation is nothing but it's a process of determining the degree of success in achieving the pre-objective. We have some objective, predetermined objective. To what extent we have achieved? We want 100% system of biomedical waste in our place. But to what extent have we achieved? Is it 80%? Is it 70% or 60%? So this will help us to know where we are and how to improve further. So measurement of action against accepted criteria and interpretation of relation among them. So what are the steps involved? We need to appraise, tell the people that we are doing the evaluation, then do the assessment, report the progress and assessment, and review it and see that where we have gone wrong. Why should we need to do evaluation? One is to safeguard the interest of recipients of hospital care, which is the moral and the legal obligation of all the administrative and professional authorities to ensure that we are providing the proper care, and we are safeguarding the interest of the people who are coming for care, and to ensure that hospitals render safe and efficient medical services to patient. And to next point is to identify inadequacies and shortcomings in the existing system which will help us to improve further, and also to provide authorities a sound appraisal of the system, saying that this is how the system is, we need to improve upon, or we need to add on to make it better so that it is effective and implemented properly. Now, so all this is a part of management aspect. So if you look at management in general, these are the roles of a manager or roles of a management. It is involves the planning of anything to be done, organizing, staffing, leading as a leader, controlling the situation, and evaluation. So evaluation is also a part of management. Evaluation can be either formative or summative. Formative means it is periodically you do as and when you progress towards achieving your objective. Summative is usually at the end of the exam. For example, what you do, your internal assessment is called as formative, end term and examination is called as the summative evaluation. So, what are the things we can evaluate in respect to biomedical waste management? Structural, whether we have adequate facilities, adequate personnel are there, and finance and materials which are allocated for the waste management is adequate or not. How much is it adequate? These are the things which you can look at. And processes, whether the policies are in place, procedures are in place, whether these policies and procedures are implemented, and how the services are utilized. Content, actual plan, how is it executed? Okay, or by waste management, how is it executed? And finally, you are looking at outcome for the hospital, how good the hospital is. Like your evaluation can be looking at how many needle stick injuries are less, or there is no occupational injuries or occupational hazards. Okay, and cleanliness rating or the patient satisfaction. All these are can be your outcome evaluation parameters. Lastly, impact for the community, that will be a in very long term impact evaluation where you can see the opinion of the community about this hospital in terms of waste management. They are very responsible. They do not throw the waste here and there. So these are some of the things which we can evaluate. Any questions still here?
Yes, ma'am.
Yes.
Ma'am, hospital stay is considered in this outcome.
Which one?
Hospital is stay,
Hospital?
stay. Patient hospital
Stay.
stay.
Yes. That also can be there. See, your hospital acquired infections also is one of the outcome. Maybe not directly, but it could be an indirect outcome. You can have a look at that also. Definitely. Next, stages of evaluation. How do we go about doing it? One is setting out questions, what you are going to evaluate, and what is that source of information from where you will collect. Will it be from hospital records, or you will do survey, or feedback, or even it could be observation also. Okay, so these are the sources of information from where you can identify, and from then you will obtain the information. This could be, for example, if you are evaluating the biomedical waste systems, you can be just observing the things in and around and note down, or you can take surveys of the healthcare workers, nurses, group day workers about different aspects of waste management, and take feedback. You can take some feedback from the administrators or the other healthcare providers, or even the patient and visitors as well. Okay, that is the different sources and how do you obtain the information. So that is then assessment of information. This can be done by the hospital itself, or you can assign this to an external agency, or even the service providers. You can ask the common biomedical waste facilities people to come and evaluate you things. So usually who will conduct evaluation? It could be your infection control committee or waste management committee. Usually in a bigger hospitals, like in our hospital, we have waste management committee is a part of infection control committee, because they share a common personnel, and sometimes waste management is also one of the component of infection control committee. So that is about who can conduct evaluation. Next important component is about infection control program. So what are the things which come under infection control program? One is surveillance of hospital acquired infections. Then if there is any outbreak, then you have to do outbreak investigation and ensure control measures. Then ensuring occupational health and safety. And the important thing, to be effective for infection control, education and informing the patient, staff, and relatives is also very critical. Having antimicrobial policy or antibiotic policy also is important for your effective infection control program. Even your hand hygiene policy you can have. There are so many policies which can support our infection control program. Can you name other policies which you can have for infection control program? Can you please tell some policies which can support the infection control program apart from antibiotic policy? Anybody? Hand hygiene policy you can have. Okay, but this thing ventilator, what is a bundle branch block, so bundle branch care. Okay, that is bundle care policy you can have. Injection policies you can have. So you can have multiple policies which can support the infection control program. And also you need to have engineering control measures which are relevant to infection control. So, okay, here it is. These are some of the policies which supports the uh, infection control. That is, have standard precautions or isolation practices when you want to isolate. Hand hygiene as a policy, you can have that for which one you will do hand hygiene, for which one you will do hand rub, all those things. Okay, and disinfection practices, housekeeping, laundry, linen, kitchen and food hygiene. You can have spill management policy, mercury policy. So you can add on to it all these policies which will support in the infection control program. Now coming to the next component of this is infection control is your functioning of hospital infection control committee. Who are the members of hospital infection control committee? It can be senior doctors, microbiologists, hospital administrator, matron, blood bank representatives, engineering, housekeeping, laundry, etc. Usually, hospital administrator will be the chairperson and microbiologist can be the secretary. What is the role of HICC? This is their role is to set up infection control program, to come out with different policies which supports the infection control program, and formulate policies and develop policies, and have periodic monthly meetings. Surveillance data again in NABH, that is the accreditation of the hospitals. HICC role is very important. They need to have periodic monthly meetings and keep the data, surveillance data of your hospital acquired infections. Usually in our hospitals also, monthly once we have a meeting where when we present hospital acquired infections, how many are there, and critically audit them, and also what to say, we do the postmortem and find out why it's more, why it's happened, can it be prevented, if it has to be prevented, what measures to be done. So that is the role of HICC, and they can come out with monthly infection control bulletin. And also that is a place where we can ask for more deployment of resources, manpower or equipment if it is required for infection control or biomedical waste management. And also establish and supervise the infection control team and ensure occupational safety by having good surveillance mechanism. Okay, any questions still here?
Ma'am, ma'am, there is any role of fumigation in,
Sorry, come back again.
ma'am, there is any role of fumigation?
I didn't get you.
Ma'am, in hospital acquired infection, there is any role of the fumigation?
Any role of what? I didn't get the last word.
Fumigation, ma'am.
Humidation.
Yes.
Humidation, you mean?
No, fumigation.
Fumigation, yes, of course. See, that's what. If you're talking of OT, you must decide what is the fumigation you will do. What is the periodicity? If there is an highly infectious case which has been operated, then when do you do the fumigation? Yes, those are all part of policies. So these are all part of practical policies you will lay down. Disinfection or cleaning process, all those things is part of policies. I told this, no? So this comes as a part of sterilization practice, fumigation. Yes, so it can be part of that. Now, what is the function of we need to have a controlled hospital infection control team under the HICC, which will actually be on job to look out for identifying the hospital acquired infection and conducting root cause analysis. Fine. Yes, and investigation of any environmental. Sorry, any questions? Yes. Can I proceed? Okay. Investigation of environment problems. They are to detect and report any community acquired infections in the hospital. And for example, there is an outbreak within the hospital and nosocomial infection. They have to follow up. And also, any policies we have in place, they will also look at compliance. For example, just simple observing of hand hygienic practices. How many times the doctors do, how many times the nurses do. So, those things can be presented in the HICC meeting, and that will be a point of discussion to see what next to be done. Is there a need for training of our doctors or nurses or monitoring of them? Okay, and training of staff on infection control practices, monitoring the healthcare responsibility and overseeing the occupational program. So, hospital infection control team is the one which actually does the on ground work. Now, coming to the healthcare waste management committee, you can in an hospital you have a separate HICC as well as waste management committee, or waste management committee can be part of hospital infection control committee. But it is the responsible of there is usually a waste management officer who will be designated, who will be responsible to liaison between the hospital and the pollution control board. Usually, it is the head of the hospital, that is the chairman, who is the chairman. All the heads of the different departments, infection control officer, chief pharmacist, radiation officer, OT in charge, nurse in charge, hospital manager, engineer, and financial control, because it involves finance, is the part of hospital waste management committee. What is their role? Their role is to see that we have good hospital waste management system in the healthcare institutions, and evolve form policies and ratify it, and also lay down the duties of various officers of the healthcare waste management, and periodically monitor and evaluate, and if there is anything to be corrected, to correct it, and also ensure that we give proper and timely training program for all categories of worker. In fact, rules only as specified that we need to have continuous training for all our healthcare workers. So, what is the task? To conjointly act with the HICC, conduct and supervise the training, or liaison with the department and matter to train the people, and be responsible to ensure good waste management practices in the systems. What are the parameters they can maintain? Yes. Okay. We need to monitor category wise waste generated in each month. If there is huge waste generated, why? We must look at, is it because of the number of the cases, or is it wastage of waste also? And also look at the financial aspects of healthcare waste management. What are the direct costs involved? Cost in terms of the supplies, cost in terms for training, because training involves money, and operation and maintenance of on-site treatment facilities, if it is having on-site treatment, or even your pre-treatment technologies, like you may have microwave and autoclave. For that also you need to look at for cost of operation and cost for centralized services, and that is the cost you're going to pay for common biomedical waste management. Also look at public health aspects. Is there injury reporting, regulatory? We are obliging, and we are creating trainings not only for the healthcare workers, even for the patients and their visitors. So I was talking of waste audit. This is one of the primary thing which we can do to see if our systems are in place. This basically, yes. Any questions at this stage? Any questions? Chauhan, you have raised your hands. Any questions? Chauhan or Urmila? Urmila, have you any doubts to ask for? If none, I'll move on. Then you need to audit how is the waste moving, what is the status of equipments currently which are used, incidence of sharp injuries and condition of protective equipments. So this waste audit can be done by the committee itself, that is the Hospital Waste Management Committee, or and by external agency like your NGOs or individuals by themselves, they can look at. So now coming to the hospital acquired infection, we said we have to have infection control program. So what is hospital acquired infection? Hospital acquired infection is any infection acquired by the patient while in the hospital, which is may occur during the hospitalization or after his or discharge. So technically, we say any fever which occurs after 24 hours of admission, 48 hours of admissions, we refer it to as hospital acquired infections. So where is the source of infection? It could be the case themselves or carriers, or improperly sterilized instrument and dressings, fomites, and any vehicle, that is your food, water, milk, blood, and blood products. Who are susceptible? Patients themselves because they are at a compromised state, or the providers, that is your doctors, nurses, healthcare auxiliaries, and hospital maintenance personnel, or the people who come to visit the patients, and people who are especially working in handling the waste, transporting and disposing waste, they are at higher risk, and our rack pickers, poor people, because they are not having good knowledge and they do not understand the risk, and they are, but they have the highest risk. So to principles of infection control, we have need to have a policy in place, good hand washing practices, and appropriate disinfectant use. And also you can have the patient admission policy with good hygienic environment, and also you monitor the infectious agent what we are using, what are the monitor infectious agent which is there, and what are the drugs which are working for that. So that's where your audit comes in, antibiotic policy will be in place. And also look at as much as possible to reduce waste and reuse wherever feasible and possible. So infection control precautions vary in different area. It can be very high in your OTs, ICUs and all, whereas in our OPD it could be very less. But all the places you must look at, laboratories, blood banks, especially during sharp handling, precautions which should be taken while transporting and also handling spillage, and you must report accident report and post-exposure prophylaxis. I'll briefly touch about PEP. I'll not go into the detail. Post-exposure prophylaxis that happens when there is needle stick injury, uh, or any injuries due to any of equipments. The risk of infection depends on amount of blood involved in the exposure, amount of virus which is present in the patient blood at the time of exposure, and whether the PP is taken within the recommended time. What should be done if there is an injury? Cuts should be washed immediately with running water, with soap and water, and splashes, like if it's into nose, mouth, and skin, it has to be flushed thoroughly with water. And if it is eyes, it has to be irrigated with lots of water or saline, and not to put your finger into the mouth, and report immediately. Initiate treatment within 72 hours and determine EC code and HIV status code, and based on that, this is, I'll not go into the, based on the what is the source of infection and what is the HIV status of this thing, we have a titer, and based on that we have basic regimen and expanded regimen. I'll not go into the treatment part. This has to be taken for 4 weeks, and it is good to take within 24 hours of our exposure. Okay, that is the ideal time to start our exposure. And what are the safety measures for waste handlers? We have hand washing facility. Should have hand washing facilities. The occupier has to give personal protective equipment measures. Not only giving, you have to train that and also monitor that whether the health workers are using the appropriate PPE, especially while handling, directly handling the biomedical waste. Then, what are the precautionary measures they're taking for invasive procedures? Better you have protocols in place, SOPs in place, adequate training and awareness, good emergency measures, and safe transport of waste and infected waste. And other safety measure for waste handling is decontamination water work surfaces as and when required, because people frequently come in contact with them. Avoid eating and drinking in hospital or the high risk places. Availability of first aid measures, good housekeeping facilities, adequate laundry, and generally having good environmental condition will help in ensuring safety. The last topic is our disinfection and transportation. So in this we'll discuss our principles of disinfection and transportation and storage. So for principles of disinfection, you need to have a written policy, adhere to the guidelines, and monitor the sidal activity of the disinfectants. Common ones which are used is natural, of course, sunlight air. We don't depend much except for linen, which after the laundry sometimes people use it to dry in the open sunlight. Most of the time it is chemical disinfection or the physical disinfection. Chemical, we have high level and medium level or low level disinfectants. High level of ones are glutaraldehyde, formaldehyde, and peracetic acid H2O2. And intermediate and low level disinfectants like alcohol, phenolic products, and chlorine products. Physical, we have your hot air oven, autoclave, microwave, incineration. Okay, all these are other disinfection, physical disinfection. Now, storage and collection and transportation. Collection, we need to have the plan of collection from the collection point, routes of transportation, and storage area. We have to decide on the frequency of collection and time, what PPE has to be done, and who has to do it, and ensure that segregation happens through and through, and adequate cleaning practices after collecting and transportation, especially the containers and the trolleys. We need to clean it frequently so that it also do not pose risk to the people who are handling those waste. And record keeping, as per the rules, all the records related to waste management should be legally kept for 5 years. And last but not the least is your capacity building and training. This is very important. This depends on what is the level of the knowledge, and creating awareness in the syllabus, and principal content of training will depend on health person. For doctors, you can start from some different level, and it can be little more elaborate. Whereas for the health workers, it should be hands-on training and practically telling what is important from their point of view and going about. So, capacity building can be your cognitive domain, or it could be skills to perform the tasks on dummy or do it independently, or effective. Address it very effectively. I'm not going to the types of domain and all. Basically, to make it realize to these people that it is important that they do this waste carefully so that they do not injure themselves or the people around them. Training tools, you should if you are planning for a training, you should decide what areas you'll do, what will be the content, what will be the mode of training, for what will be the different health cadres. So it's better they plan it and do it sequentially, because hospital staff also keep changing, and of course the patients and the visitors are changed on day-to-day basis. How do we educate them? What is the mechanism we can adopt for them for their monitoring? So monitoring is to support our system in place. We can have system monitoring, day-to-day monitoring, and periodic monitoring. Day-to-day monitoring is very crucial because this will help them to keep on their toe. Periodic monitoring to give the report or see how better you can improve and all those things. And legal considerations, you must be aligned to the biomedical waste trials rules 2016. As an occupier, we told the other day, no, occupier is one who is having administrative control. Some of the important roles, as a hospital in charge, his responsibility is to provide final storage room, phase out of use of chlorinated plastic bags, gloves, and blood bags, provide training to healthcare workers, and his duty is to immunize all health workers with tetanus and hepatitis B, and also provide personal protective equipments adequately, and conduct health checkup for health workers and maintain barcode systems. So he has to report any major accident within 24 hours. Untreated waste should be not be stored beyond 48 hours. And any irregular visit by the CBW, it has to be reported to the Pollution Control Board. And if it is more than 30 bedded, we need to have a committee in place. If it is less than 30 bedded hospital, we need to appoint a waste management officer who will be responsible to ensure that waste management systems are happening. So this is a model waste management committee. I'll skip on this. Every by 30th June of every year, annual report has to be submitted in Form 4 and also display the annual report on their website. So details what we fill up in Form 4 is your quantum of general waste, size and capacity, minutes of meeting, details of training, accidents, waste management, liquid waste management. So I told you all records should be maintained for a period of 5 years pertaining to waste management, be it from generation to final treatment and disposal. So these are the forms which are available under the rules. Form 1 is for accident reporting. Here accident reporting is major accidents, not the needle stick injuries. Form 2 is to apply for authorization or renewal. Form 3 is authorization given by the Pollution Control Board. Form 4 is annual report to be submitted by the healthcare facilities. Form 5, if there is any show cause notice, any notice, legal notice served by the Pollution Board, it is to appeal for. You can visit the rules book, how much it measures, all the standards are to be maintained. So this I think mandated to have symbols, all the bags and containers to have the appropriate symbols. The role of WHO, I'll not go into these details, I think somebody else will manage. So to summarize, uh, essentials for safe management of system is to have a life cycle approach, good attitudinal change, have policies in place, committees, have protocols and SOPs, record maintenance and training. Okay. Okay. I'll skip this one. So this is the bottom line. To have worker safety and patient safety, we need to have proper life cycle approach of the waste management from the segregation till final treatment disposal. Any questions still here? Any questions still here?
Yeah, ma'am.
Yes.
Ma'am, under this 30 bedded hospital, the hospital can appoint any staff or outsider of for this committee or the staff for the monitoring or evaluation.
Okay. For that, I'll answer with this story. Uh, I think this is very important for our waste management. There were four people in. I think you are all aware of this story, but related to the biomedical waste management. Everybody, somebody, anybody, and nobody. There was an important job to be done. Everybody was sure that somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about it because it was everybody's job. Everybody thought anybody could do it, but nobody realized that everybody would not do it. It ended at that everybody blamed somebody when nobody did what anybody could have done it. Did I answer this?
Yes,
So
ma'am.
it's
Yes, ma'am.
all our responsibility.
Yes, ma'am. Last time we have discussed the attitude over this, and my question is, ma'am, we can be appoint internal staff or the outside
No,
expert
no, you
as
can have your internal staff.
okay. Thank you.
No issues. Better to have internal staff on a day-to-day basis, no?
Okay.
Okay. Before we move on to the next topic, Dr. Suman will handle the next topic. Meanwhile, I thought I'll play one video on. You want English or Hindi?
English, ma'am.
English, right? Okay. Uh, a video on occupational safety. Okay. Then Dr. Suman will join and she will start next class. Okay. If no other questions on this topic, play the video. Meanwhile, Suman has joined. She will take the class. Suman, I'll play the occupational safety video and then you can take over.
Okay, okay.
Urmila, you have a question to ask and is raised.